Breast cancer does not discriminate by age. Unhealthy lifestyle habits like consuming high-calorie diets, smoking, and leading a sedentary life don't just harm your heart, they are also increasing your risk of all cancers, including breast cancer. 12 warning signs that could be your body's way of saying something is definitely wrong. Knowing the reasons can empower you to take preventive actions. After all, knowledge is power. Breast cancer, a silent threat that millions of women face. But what if I told you that knowing these 12 warning signs could save your life or the life of someone you love? Did you know 1 in 8 women will develop breast cancer in her lifetime? But here's the good news. Most cases are treatable if they are caught early. Let's make sure you are not one of the unlucky ones. Breast cancer is one of the most common cancers in women these days. But you know the sad truth? Many of us miss its early signs. The video will show you the 12 crucial warning signs that you should never ignore. Plus, I'll share practical tips to help you reduce your risk. And if you think this is just for older women, think again. Breast cancer does not discriminate by age. Before we get into the science, let's explore the 5 causes of breast cancer. Knowing the reasons can empower you to take preventive actions. After all, knowledge is power. So the number 1 cause of breast cancer is age. As we age, our cells undergo changes. For women crossing the age of 50, it significantly raises the risk of breast cancer, especially after menopause. This is because hormonal changes during menopause can trigger cellular imbalance. The second one is hormonal factors. Hormones play a big role in breast health. As per NIH research, starting menstrual periods before the age of 12 and reaching menopause after the age of 55 can increase a woman's exposure to hormones for a longer duration, thereby raising their risk of developing breast cancer. You can see the highlighted research on the screen. The third one is lifestyle triggers. Unhealthy lifestyle habits like consuming high-calorie diets, smoking, and leading a sedentary life don't just harm your heart, they are also increasing your risk of all cancers, including breast cancer. As you can see on the screen, research highlighted the critical role that diet and nutrition plays in the development as well as in prevention of cancer. Fourth one is environmental chemicals. Your skincare routine might be more dangerous than you think. Product containing parabens, phthalates, and many other synthetic chemicals, they mimic hormones in the body, creating an imbalance. These chemicals act like estrogens in the body, which lead to overstimulation of breast cells. For example, products like certain deodorants, cosmetics, and lotion can expose you to these harmful chemicals in a lot higher dose than what's safe. Fifth is hereditary risk. Let's debunk a myth. Only 5 to 10% of breast cancer cases are hereditary. This means 90% is because of lifestyle, and early detection is even more crucial. See, genetic mutations like BRCA1 and BRCA2 can be passed down in generations, but they're very rare. It's far more common for breast cancer to develop due to environmental or hormonal factors. Now that you know what might cause it, let's talk about how your body warns you when something is wrong. See, breast cancer doesn't always start with a lump. Let's dive into 12 warning signs that could be your body's way of saying something is definitely wrong. Let's start with the most well-known sign, which is a lump in your breast or underarms. Now, not every lump is cancerous, but here is what you need to look out for. A lump that feels hard, has an irregular shape, and does not move under your skin. It's a big red flag. Benign lumps, on the other hand, are often smooth and movable. But remember, any lumps that feel unusual should be checked by a doctor right away. The second warning sign is skin changes around the breast area. Have you noticed the skin on your breast becoming thick, dimpled, or resembling an orange peel? This happens when the cancer cell, they block the lymphatic drainage which is happening in your breast area. And then this is an unusual texture that gets produced, and it is often associated with a very rare but aggressive form of breast cancer, which is known as inflammatory breast cancer. The third warning sign is nipple retraction or inversion. If your nipple suddenly starts pulling inside or becoming flat or changing its shape, it could indicate a tumor underneath. This happens because the cancerous growth, it pulls out the tissues around your nipples. It is something that you should never ignore. So these are the signs which are giving you the power so that you can watch them for your own and take a medical treatment at the earliest. The fourth warning sign is unusual discharge. If you are not breastfeeding but notice any nipple discharge, especially if it is bloody, it's time to see a doctor. This type of discharge often happens when tumor disrupt the milk ducts. Don't wait to get it checked. The fifth warning sign is breast pain or tenderness. Breast cancer is usually painless, but if you are experiencing persistent, unexplained pain in one breast or nipple, do not dismiss it and watch your doctor at the earliest. This pain might feel like a dull ache or a sharp sting, often caused by tumors pressing on nearby tissues. The sixth warning sign is redness and warmth. Does your breast feel unusually warm or look red? These aren't just signs of an infection. They could indicate an inflammatory breast cancer which needs to get checked. Cancer can block lymphatic vessels, causing blood to pull and the skin to appear red or feel warmer than usual. The seventh warning sign is change in breast size or shape. See, if one breast suddenly appears larger or smaller than the other, it could be a tumor affecting the surrounding tissues. Breast tumors can distort the natural contour of your breast. So any sudden change in shape or size should be evaluated by a doctor. Eighth warning sign is fatigue and weakness. Do you feel tired all the time? Even when you have had plenty of rest, you're eating well. This could be more than just everyday fatigue. Cancer cells need nutrients to grow and they compete with the healthy cells for that, leaving your body feel drained of energy. And breast cancer is no different. It can cause anemia, which further reduces your energy levels. So if you are feeling unusually weak or fatigued without a clear reason, it's worth consulting. Ninth warning sign is swelling in the armpits or collarbone. Have you noticed any swelling or lumps armpits or near your collarbone? This could mean that breast cancer has spread to nearby lymph nodes. Lymph nodes act as filters in your body, and when cancer spreads, these nodes can swell or become tender. It's an early warning sign of metastasis and should never be ignored. If you feel anything unusual, make an appointment with your doctor at the earliest. Warning sign is ulcers or sores on the breast. Have you noticed an open sore or ulcer on the breast that just won't heal? This could be more than just a skin infection. It might be a sign of breast cancer. As the cancer progresses, it can break through the skin surface and create ulcer-like sores that may ooze fluid or pus. These sores often come with redness and inflammation. If you notice anything like this, seek medical attention immediately. 11th sign is increased visibility of veins on the breast. Have you noticed the suddenly veins on your breast becoming more visible and suddenly appearing all of a sudden? This is one of the lesser known signs of cancer, but it's important to pay attention to. See, cancerous tumors, they demand a lot of blood to grow, which can disrupt normal blood flow and cause veins to swell. This increased blood supply may lead to visible vein enlargement and inflammation. So we have to watch out for this, and this is more common in some forms of breast cancer than other, but it might be best that if you are seeing any change like this, it's best to get it checked. And 12th warning sign is persistent back or shoulder pain. Have you been feeling unexplained pain in your shoulder or in your neck, which is no apparent cause? This could be more than just a sore muscle. It could be your body's way of trying to alert you to something which needs your attention. Sometimes pain can be a result of muscle issues, and sometimes it can be a result of tumor pressing. The video is not trying to scare anyone, but it's more like if there are any unusual signs, it's better to get them checked. See, a lot of these symptoms may sound scary, and many a times they are benign as well. So no need to panic. It just means that maybe this is one sign I'm getting and I need to get it checked. Not all pain, in fact, majority of not all of these symptoms are linked to cancer. However, it's always better to be cautious, and because the cure rate when you discover a cancer early are so much better, hence it's important to be mindful. If you are experiencing anything unexplained or persistent in your body, it's better to get it checked, because early detection can make all the difference in these cases. Now let's move forward and talk about how to protect yourself and take control, so that I reduce my chances of ever getting the cancer in the first place. All these discussions sometimes can seem intimidating, but the good news, there is so much there is so much we can do to reduce our risk. Let's start with 4 actionable points which we can get started on. The first one is maintaining a healthy weight. See, because every kilo counts towards reducing your risk. Second one, saying no to harmful chemicals, the synthetic chemicals. Ditch all these chemical-laden products and embrace a natural living. So you have to see where are you getting these chemical feeds from and try reducing it as much as possible. Number 3 is breastfeeding if you can. It's not just good for your baby, it is protective for you too. So women who breastfeed their children have far lower risk for breast cancer compared to those who don't. And number 4 is think before you drink. Alcohol is not just empty calories, it's a direct risk factor. See, small changes can make a big impact over time. And here is how we can take our health to the next level. But how do we start so that I reduce my risk of developing these type of situations? See, at Yuvaap, we believe in holistic health. Everything from diet to nutrition to mindfulness to my workouts, everything contributes in creating a body so that cancer cells can't survive. Whether it is through pranayams, through yoga, through meditation, everything is around building a very conducive body for health, not for cancer. For this, there needs to be a tailored plan that understands the unique body need, that understand what are the risks, and that the plan has to empower the person to live their healthiest life. And how do we take charge of our health in this entire process? See, real changes will start with action. If I have identified, okay, there is someone in the family who has it, or maybe I have a hereditary risk, or maybe so far I was not taking care, and today I want to take that step to get a personalized wellness plan for myself. You could talk to us on the number given below, and definitely we could work together to see how wellness can be an integral part of this journey that you have. At Yuvaap, we believe that health is not just about avoiding illness. It's about living in harmony with yourself and living with harmony around the world that we have. Every small choice that we make can have a big impact on our tomorrow. So bye-bye for now. Thank you for watching. Stay curious and keep finding your why with Yuvaap.